I get so many questions about my lip filler, and for good reason. So today, you guys, I'm gonna answer questions about lip filler and tell you some things that I wish I would have known before I got my lips done. First off, lip augmentation has come a very long way. People have wanted big luscious lips for years. Celebrities have been doing a lot of different things. Back in the 80s, the techniques were not as awesome as they are nowadays. I mean, it's so simple to get lip filler these days that so many people do it. And I think that's why it's becoming more and more popular, is because it's just so much easier. The technology is so much better, and they look a lot more natural if you go to the right person. I remember like in the 90s, maybe the early 2000s, there were these rumors of these Hollywood like filler parties, and this one doctor would go to these celebrities' homes and he would inject their lips and other areas of their faces and bodies with silicone, and he botched a lot of people. There are a lot of people out there, I'm not gonna name any names, you can just Google this stuff, that have botched or got botched because of this man, because people just wanted those luscious lips. They got their lips really messed up. This just goes to show like how far we've come with the lip filler. People actually talk about what they're doing now, and I've got my lips done. Haha, and it's changed my life, I love it. So one thing that's funny about my lip filler is that I didn't actually think I needed it at all before I got it done. In high school, I had a much fuller upper lip, but with age, your lips start to thin, unfortunately. It's another one of those things that starts to go. You know, it was over the last few years that I started to notice in pictures that I felt like I looked a little bit gummy when I would smile. It would look like I was doing like a it started to not look pretty to me, and it was just my upper lip. I've always been fine with my bottom lip, but the upper lip was starting to bother me. And I know it's like we should be happy with who we are, but come on. If you can do something about it, why not? And I wanted to do something about it. I'm good friends with Dr. Deer. You guys all know I love him. And he does really great lips. He's got an amazing technique. He's got a really good eye. And we went ahead and did it for an episode of The Sass. And I was really excited about it because it really did change my appearance. I really do think it did. We started off really slow with it because I was like, oh, I don't want to look like a different person. It's like, oh my God, I don't want to look like I've got fish lips or duck lips or whatever, you know? And so we took it really slow. We went really easy for the first time that I did it. I don't think anyone noticed it really the first time. It was the second time that everyone started to like make comments about my lips and stuff. But we have a whole episode of The Sass if you want to watch that on the way he does lip filler. He did it on me. And I've gone in a few more times since then and had my lips redone, and I love it. Anytime I post like a throwback picture on Instagram, I'm always like, oh my God, that lip. It's like the only thing I can look at now. It's crazy. It's changed my life. I love my lips. One of the most common questions I get is, what is the filler made of? So I specifically have filler that's hyaluronic acid. Hyaluronic acid is naturally occurring in our skin. It's what gives us that like plump, hydrated look, which is why a lot of people like to apply it topically, because it works a little bit different. Anytime anything's applied topically, it's obviously gonna work a little bit differently. It's not gonna just penetrate and replace that, you know, ingredient that's in your skin, but it does work as a humectant when you put it topically. Hyaluronic acid that is used in fillers is obviously synthetic. It's not from an animal or from a human being, but it is fairly safe. The studies on it and everything show that it really doesn't harm your body or poison you or anything like that. So it's a really safe ingredient. Hyaluronic acid in filler will plump your lips, but it also traps water within your lips, so it really doubles as like that plumping mechanism. It really works well. It's a nice way to get that fullness in your lips and make it look natural, as long as it's done right. There are other ways that people get their lip filler these days. I mean, they still use collagen if you really, really want it. Back in the day, it used to be bovine collagen that they would use, which means that it came from cow, and I don't think it really lasted very long, so they'd have to constantly upkeep the lips. I think that they still can technically do that, but I don't know anyone who does it, and I don't know anyone who suggests it. Another option is fat transfer, but it's a much more permanent option. The fat eventually will dissipate, I guess, over a few years, the way fat probably just naturally does as you age. I would maybe get it done with hyaluronic acid first and then get the fat transfer, because hyaluronic acid, if you don't like it, the best thing about that is you can dissolve it. It doesn't feel good when you dissolve it, but you can dissolve it and get rid of it. The second most common question I get is who did my lips and why I think it's important to go to someone like the person that did mine. So again, I went to Dr. Deer. He is a facial plastic surgeon in Beverly Hills. Not only is he a friend, but he was actually like the first doctor to ever give me Botox, and we've eventually grown a friendship over the years of working together. I think he's got a great eye, which is one of the most important things about lips, is somebody who has that same like aesthetic, like they like the same aesthetics as you. So looking at someone's Instagram, for instance, can really help you decide if they have the look with the lips that they do, you know? He's all about being conservative and making sure you don't go overboard with the lips. He doesn't like to make you look like you've got duck lips, which was a big one for me. And he's got a different technique. I really like his technique. He's perfected it. He calls it the bow and arrow, where he's threading the lips. So he's using just a few holes in your lips, 4 on the outside and then 2 right here. He uses a cannula, which is a blunt tip needle, and that means it's not gonna like puncture your lips as it's going in. So he makes a hole, then sticks the needle in, and then he just slowly releases the hyaluronic acid in your lips, almost like in threads, he calls it. He threads it, but it's like little layers on top of each other. To him, he likes that look because it looks a lot more natural. He also thinks that it minimizes bruising, it minimizes swelling, so he can actually get a good look at what your lips are looking like before it gets too much, you know? Like, whereas there's another technique where people can do something called micro droplets, and that one you probably see a lot on Instagram, where people like just go poke, 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 and they just keep like injecting it all throughout the lips. That technique is also a fine technique. I've had it done like that actually before. The thing with that technique that Dr. Deer says is that it can cause swelling in those little areas, so you kind of get uneven swelling, and he can't tell if the bumpiness is from swelling or if it's from the filler, like having too much in one spot. So he likes this technique that he does, and then he really goes in. The bow and arrow part is he really thinks it's all about shape, so that's one thing that I really like too. He's all about the shape, not necessarily the size of the lips. He's not all about like huge lips, he's all about the shape of your lips, because shape of your lips is like a trait of youth, you know? You want to have like perfectly shaped lips. So he goes in and he really accentuates the Cupid's bow. He does not inject the outer corners of your lips, and that means he doesn't put filler here in these areas. And that is known to really be a big cause of that duck lip look, is when you've got filler here. Because like, if you think about it, like how thick are our lips on the ends, you know? They're not like, So you want to make sure that you go to someone who has a really good technique. If they put it there, you should ask them why, and definitely look at pictures of past patients that they've had so that you can see what that look is gonna be. I also recommend that you stay consistent with the doctor. Like if you start going to somebody and you really like the look, even if that person is expensive, I would stick with that person. You don't wanna hop around to different injectors and then end up looking a lot different. Maybe they even use like different types of hyaluronic acid in your lips, and you just have like this look that's not consistent. You wanna make sure you look like yourself. You wanna make sure it's harmonizing with your face. So again, not too big because you don't want it to be the only thing that people look at. You want your lips to just look pretty. You know, it's just one of those things where you wanna make sure your lips are not the focus. Another question I get, how long does it last? So technically it's supposed to last about 4 to 6 months. If you go to someone really good, they're gonna be conservative with you, so they're not gonna go as big the first time. So you probably do need to go back after at least 6 months because it starts to get a little bit smaller. And that's actually like when you go back and you really perfect it. I feel like the second time is when they get it perfect, because then they have like a little bit of something to work with to begin with, and they know how you're gonna react and everything. So then the second time you get your lips done, you're like, ooh. But I will say, you know, once you like start to do filler, it starts to last longer and longer. They give you kind of a range because it's all dependent on your metabolism, how fast your body metabolizes it. That's truly like the indicator. One thing I will also say is filler doesn't ever truly go away. I've heard a lot of people say like, your lips will go completely back to normal. Not true at all. Filler always has a little remnant. Like there's always remnants of filler. So the more you get filler, no matter where, lips, cheeks, anywhere it is that people get filler, if you get it done, it eventually leaves remnants in your lips or your skin. You know, you're always gonna have like little bits of it, and it'll be there for years, and it could just be like little goopy, gross things. Like filler's kind of nasty when you really think about what it is. It's like you're putting this goopy stuff in your skin, but it stays there. And so over time, you actually sometimes might even want to dissolve it if you've been doing filler for a really long time and start from zero, because it doesn't completely go away. Like we all know, like Kylie said that she dissolved her lips. I don't know. You know, maybe she like let it just go away, but that means that it's still a little bit there. It's never going to truly go away unless she truly dissolves it. Recently, Huda, for instance, Huda Beauty, posted a video of how she had gone to a doctor, and that doctor actually recommended that she dissolve her lips because it was starting to look fake. And that was a really great video, I actually think, because it's true. Like over time, your filler is just gonna look lumpy and bumpy and stuff because there are remnants of it left in there, and it's there for years. So if you get a lot of filler done, sometimes it's good to take a step back, dissolve it, and then you can start from scratch or have nothing. I also have this theory, a lot of like doctors don't really talk about this, but every time you're injecting your skin, you're creating these itty bitty scars in your skin. So if you get lip injections done a lot, especially if you're doing the micro droplet technique where they're just poking and poking and poking and poking, you're getting itty bitty scars, and scars eventually turn into, it's scar tissue and it gets thicker and thicker and thicker over time. So no matter what, when you're altering your appearance with things like filler, you're still doing something that's permanent. I think a lot of people don't consider that, but you're still doing something permanent. So maybe if you get it done once and you let it just go away, sure, it might pretty much go away, but it's not 100%. It's still an injection, it's still puncturing your skin, you're still getting scar tissue. Another question I get, this might actually be the most common question I get, how much does it cost? Lip injections, lip filler, can be really expensive. And it can go anywhere up to like $1,500. I think when I got it done, it was like $800, $900, something like that. I think Dr. Deer's prices have gone up. I haven't gone in for a long time because I got to that point like after the third time where my lips were pretty much staying. But on average, I'd say like a good doctor in Beverly Hills is anywhere between like $800 to $1,000 to get your lips done. And you hope that it lasts for like a year. There are cheaper options. I just don't recommend it. It starts at hundreds of dollars, I guess, if you go to a med spa, but I don't recommend just going to any old med spa to do it. You really want to make sure your lips look good. You don't want them to look bad. They can really mess up the shape of your lips too if they do it wrong. That is like a dead giveaway for having any kind of plastic surgery, is when you get something really bad. Like bad lips are bad lips. Like I've seen it before, I see it, I'm not gonna stop seeing it. Another question, is it painful? I personally think so, yes. Yes, it's painful. It's not comfortable, I'll give you that. Dr. Deer likes to really make his patients numb. Like he actually gives you a dental block, which is what they give you like at a dentist's office. It's that injection into your gums where you just go completely numb in this area and you feel like swollen or something because you can't feel anything like from here down, and it's for hours for me anyway because I'm very sensitive to any kind of like anesthesia or numbing anything. It just like, it really affects me. So I don't actually feel the lip injections, but I still don't find it to be a comfortable experience to be just like numb the whole time and like have like all this pressure and stuff. And you know what, the numbing injections don't feel very great either. So I would say it's a very uncomfortable experience. I've had friends tell me that they've gone to other people and they just put numbing cream on them and it killed them. Like they said it was the most painful thing they've ever done. And it makes sense because lips are very sensitive. So is it painful? I think so. Next question, do my lips feel like my own lips? Like do they feel normal? Right now, my lips feel like my lips. I'm completely used to having it in my lips now. It's been 2 years since I started getting it done. The first time I got it done, my lips were so sore for like 2 weeks. Actually, even for months, I felt like I couldn't even completely like blot my lips like that. I felt like it didn't feel right. It didn't feel like my lips at all. But then I got used to it. And I think as like the swelling and the pain went away, they start to feel like my normal lips. So the first time I feel like they didn't feel completely like my own, and now they just 100% feel like my lips. But a couple of things I wish I would have known before I got my lips done is that my lips constantly are chapped now. It's one of those things, it's like I stretched out my lips, I guess technically. So it's like showing the inner part of my lips that would have been like more in my mouth. It's more exposed to the air. So that part gets a little bit more dry and chapped and flaky on a regular basis. So I have to constantly deal with that. And I did get bruised once, and man, that bruising can really last a long time. Anybody can do it. The best doctor can accidentally bruise you because you know what, they're sticking a needle in there. So you could end up having a bruise, or if you did something like took fish oil supplements, drank some alcohol, took some aspirin, even maybe drank some kombucha, anything like that can cause your blood to be a little bit thinner, and that can cause some bruising. And so you wanna make sure that you're really staying on top of that before you go. Like I've heard people tell me, when they ask about the pain and I'm like, it's painful, they're like, well, maybe I'll just get a little tipsy before I go get my lips done. It's like, no. You don't want that because you could bruise. And that's a big deal because the bruise will not go away for like a week or two. Like it lasts for so long. Like even when like the 2 weeks pass, if you look at the bottom of your lip and stuff, you're like, man, I can still see like a little darkness there. So the bruising does last a long time. Hopefully you don't get bruising. I've only had it once of like the 3 or 4 times I've done my lips, but when you do bruise, it sucks. And final question, do I recommend getting your lips done? I personally do. I love my lips. I feel like it changed my world a little bit. I like looking at my lips a lot more now and putting on lipstick and stuff. But it really does come down to going to the right person. And I know that's such a loaded thing to say because it's like, well, what makes it a right person? And I obviously go to like the easy ones where it's like they're board certified in, you know, dermatology or facial plastic surgery or plastic surgery. You need to look at their Instagram, you need to look at their Yelp pages, you need to talk to people who have been patients and get their experiences. And you can't always just go and do a consultation too. It doesn't hurt to do a consultation because there are a lot of things that go into it. You wanna see what kind of like an aesthetic eye this doctor or injector has. You know, you wanna know what it is that they're gonna do to you, because some places might have, you know, just like a one size fits all look for everybody, and you don't want that. You want somebody who's gonna look at your face and be like, this is what we need to do. I see like this needs to be filled a little bit. We need to accentuate this part of your lips. You know, you want somebody who's gonna really customize it to you and make sure that it just looks really nice for your face. And that's just, it's hard to find. Just because a big influencer went to them or a celebrity does not mean that they're the best. You guys know how I feel about that, because you know what? You don't wanna mess up your face, and that's always the thing I wanna say, is you don't wanna mess up your face. So that's my video on lip filler. I hope this video was helpful. I hope I answered your questions. If I didn't, definitely ask below in the comments. And if you have an experience that you wanna share, definitely share it in the comments, because I think, you know, beauty is so personal and everyone has such different experiences. So sharing your experience and sharing who you went to, even if they were good or bad, can be really helpful for people. So definitely leave all those comments, give this video a big thumbs up, subscribe, and I will talk to you soon. Bye.